So let's talk about blepharoplasties. So one of the most common complaints from patients in general, not even elderly patients even in their 20s or 30s, is I am told that I get a tired look to my eyes. The most common reason for that is problems with either your upper eyelid or your lower eyelid. So with your upper eyelid, it's natural to get a little bit of extra skin there, and that extra fold can cause you to have that tired appearance. Our approach to address that is to go in and make an incision right in that natural crease in your upper eyelid and remove some of that extra skin. Really helps tighten the eyelid, and it's a well-hidden incision where actually whenever your eyes are even open or closed, it's really difficult to see. It's a relatively straightforward procedure that can be done either awake or in our operating room. Now let's talk about the lower eyelid, which is a little bit more complicated. As we age, we have a natural layer of connective tissue that holds back the natural fat pad that's there. Now, one thing that happens is that weakens, and so you have a little bit of bulging of the fat there. And so that can cause kind of that puffy appearance. Patients complain that it varies throughout the day. It really makes them look tired all the time. And so what we do with a lower blepharoplasty is we go in and either remove or reposition some of that fat that's there that's causing some of that puffy appearance. And so we do that through either an incision that's hidden right underneath your eyelash line or on the inside of your eye. One thing that we most commonly do is tighten your lower eyelid as well. That way you have that refreshed appearance that should last a long time for you. In general, either an upper or a lower blepharoplasty should take about an hour, depending on your specific case. And when combining the two procedures, then takes about 2 hours. Now, obviously, if we're doing it awake and you need a little bit of extra time or that sort of thing, then it can take a little bit longer as well. So expectations after surgery is you'll have some bruising, particularly with the lower eyelid, but that should resolve within that first week. And at your 1-week appointment, we'll remove any sutures that you may have. And then at 3 weeks, you can resume cardio, that kind of exercise. And at 6 weeks, you can go back to heavy lifting, yoga, Pilates. At about 48 hours after surgery, you can start washing your face like normal with soap and water. And then at about 2 weeks or so after surgery, depending on how you're recovering, is where you can go back to putting on makeup. Additionally, whenever doing any surgery for our eyelids, either upper or lower, this can be commonly combined with either other facial procedures or body procedures as well. With facial procedures, it's most commonly combined with either fat grafting or patients that want submental lipo, or even patients that are wanting to get a face or neck lift. With body procedures, it can be combined with really most anything. The big thing is that we don't want to overload the body and do too much surgery at once. So if we're talking, extended tummy tuck, breasts, neck, then we're starting to get into a little bit too much surgery to safely do. And those are times in which we'd want to stage things out. Additionally, especially if we're doing both upper and lower blepharoplasty, this can be combined with other med spa procedures such as laser, Morpheus, fat grafting / filler. And one benefit of this is these procedures can also help really amplify your results from your upper or lower blepharoplasty. So we're talking about kind of addressing the fine lines both in your skin, some of the wrinkles that can be done with some of these less invasive procedures. If you're looking for a refreshed look, a functional improvement, or both, I'm Dr. Manny, and we'd love to chat with you.